It's Alcohol Awareness Month. Alcohol sales have risen in the past few weeks. Alcohol and other substances like prescription drugs, marijuana, and other drugs are what many people turn to in order to cope with stress. But that increased use can impact your physical and your mental health in many ways and put you at risk for substance use disorder. In MedWatch, Michelle Dunaway talks to Paul Bach and Kimberly Johnson, two certified peer recovery coaches at Munson Healthcare.
Paul, Kim, thank you so much for being here. We're going to start out, how is the situation that we're in with COVID-19 more of a trigger for substance use disorder?
Well, substance use disorder is a disease of isolation. If you're alone with yourself for too long, things can go sideways in a hurry. A lot of people may use more now because they don't have usual support systems. Perhaps they don't know who to talk to or where to turn.
And what are some signs that you might be at risk for substance use disorder?
First, I think it's important to acknowledge that substance use disorder can affect anyone in any age or any income group. Under normal circumstances, it can affect day-to-day activities like how you function at work. And a lot of people right now aren't working, so they're kind of stuck at home doing something completely different, and everything has changed. There are some at-home signs, maybe if things are going wrong, such as increased use despite wanting to cut back or quit, giving up on important activities because of their use. And day-to-day patterns may also be affected, like sleep and energy levels.
And so what can a peer recovery coach do to help? How do they help in this situation?
A peer recovery coach is really someone who has walked the walk. We are people in recovery ourselves, so we've experienced a lot of the situations that people are in. And we have survived it and come out the other side. I always say, I just want to have a conversation. I just want to sit down with somebody and ask them, how can I help?
People share things with us because we know what it's like. And a lot of times they share more with us than they do with their own counselors, because we kind of open up with them and let them know, we know where they're at, and we, understand, and by opening up ourselves and telling people about our experience, they tend to open up a little bit more to us than they would other people.
But there is sort of a stigma involved with this. And what if someone's watching this and they feel like asking for help is a sign of weakness, or maybe they're embarrassed or feel ashamed? What's your advice to them?
People who suffer substance use disorder often feel judged and carry a lot of shame. I like to always say that, asking for help takes a lot of courage. It's brave to ask for help.
I just want to stress that it's okay for that person to be exactly where they are at. Nobody's here to judge you. We're here to make you feel comfortable and ask, what do you need? What resources can I help provide to you? We're here now, and we're here whenever you're ready.
If somebody is ready right now, they need help, or a loved one thinks that someone that they care for needs help, what should they do?
You can find a certified peer recovery coach like Kim or myself by calling 231-935-6382. This number will help connect you to somebody. You don't need anybody to tell you to do it or referrals. It's just pick up that phone. Whatever you do, stay connected.
For more information on the resources available to you, go to 9and10news.com.